because I'm sure a lot of you are new to LINEA, I just wanted to say that LINEA, we sit within the Gender Violence and Health Centre at the London School of Hygiene and Tropical Medicine, or LSHTM. LINEA is an international and multi-pronged project looking at how social norms theory can be used to prevent the sexual exploitation and abuse of children and adolescents globally. We've included our Twitter handle and webpage on this first slide, and we encourage you to join the LINEA network mailing list, which you can do via our webpage. And we share regular updates about our work and notices about future webinars. So today we're really looking forward to this webinar, which is entitled Unite for a Better Life, Developing and Testing an Intervention to Reduce Intimate Partner Violence in a Humanitarian Context. We've got a wonderful presenter for you today, Dr. Vandana Sharma, who's a global health researcher at the Harvard T.H. Chan School of Public Health and the Harvard Humanitarian Initiative. Dr. Sharma's research includes randomized trials of interventions to reduce maternal mortality in northern Nigeria and reduce IPV and HIV transmission in Ethiopia, as well as mixed methods IPV research among Somali refugees. And IPV stands for intimate partner violence, of course. Her other current research interests include assessing gender biases within humanitarian organisations and measuring gender-based violence risk mitigation in humanitarian emergencies. In 2018, Dr. Sharma was named to the Canadian Women in Global Health list, and in 2019, she was awarded the Canadian Excellence in Global Women and Children's Health Award. So yeah, we're really lucky to have her. So today's presentation will last about 40 minutes, and there'll be time for Q&A at the end. So we warmly welcome you to use the chat function, and I'm sure you're all familiar with that by now, to enter your questions on the screen to the presenter, and we'll read them out at the end. We're hoping to have a really lively discussion after what promises to be an absolutely fascinating presentation. And just to let you know, we'll be recording this webinar and we'll be uploading it onto the LINEA YouTube channel later in the month. Please just make sure that you stay muted during the presentation so that Vandana can present clearly. So yeah, over to you, Vandana.
Wonderful, thank you so much. And it's great to see such a fabulous turnout. I'm really excited to have the opportunity to share some of the lessons and findings from our work on behalf of our team and partners. So as Lottie indicated, I will be speaking about Unite for a Better Life, which is a program to prevent and reduce intimate partner violence. And our team adapted and tested that program in a humanitarian context. The project was implemented in Dolo Ado, Ethiopia between 2016 and 2018 with a number of key partners. That includes Women in Health Alliance International in Ethiopia, Addis Ababa University, as well as Harvard Medical School. And there was support received as well during implementation from UNHCR and as well from Ethiopia's Agency for Refugees and Returnees Affairs. And we received funding from ELRA's Humanitarian Innovation Fund for this work. Next slide, please. So the agenda for today's discussion includes a brief introduction, followed by a discussion around the original Unite for a Better Life program, which was developed for rural communities in Ethiopia, and then followed by a discussion around our work to adapt the UBL program for a humanitarian context, and then finally our pilot testing and next steps for the project. Next slide, please. So we'll begin with just a really short introduction. So next slide. And so the project that I will be speaking about builds on a number of years of previous research and programming that our team has undertaken, not only in the refugee camp setting, but as well in other parts of Ethiopia. So this slide really summarizes the different research and programming streams that our team has undertaken to generate evidence about what works in different settings. So as I mentioned, Unite for a Better Life was first developed for the rural Ethiopian context, which is the box there on the left-hand side. And in that setting, this gender transformative IPV and HIV prevention program is delivered within the context of the traditional Ethiopian coffee ceremony, and it's delivered to groups of men, women, and couples. And our team tested that intervention in a large cluster randomized control trial, which included almost 7,000 households in 4 districts in the western part of the country. And I'll just briefly mention that the results do demonstrate significant reductions in intimate partner violence, in particular sexual IPV, as well as significant changes in HIV outcomes, including confidence in using a condom, HIV testing, and condom use. And the results are forthcoming, so please do keep on the lookout for those when they become available. And then, so the bulk of today's talk will be around this sort of second box there in the middle, which is our project focused on humanitarian contexts. So as I mentioned, we received funding from ELRA to adapt UBL for the humanitarian context, which in this case was Somali refugee camps in Dolo Ado, Ethiopia. And we first conducted formative research in this setting to understand the drivers of IPV and HIV risk in this context, including how displacement has changed risks. And then we adapted content for this particular setting. New sessions were also added into the program, and then the program itself was delivered in this setting within Somali tea talks. And then I'll just briefly mention our third project under the Unite for a Better Life umbrella. So in order to reach harder to serve populations, including displaced populations in emergencies, we received some funding from the World Bank and the Sexual Violence Research Initiative to expand the UBL program to include a podcast series where episodes correspond with each of the in-person sessions. And what's really unique about that program is the user-centered design approach, where refugees were involved to co-create the episodes with our team. And that was piloted last year in 2019. Great, next slide, please. So to give you a bit of an idea of the context, as I mentioned, we're working in a Somali refugee camp in Ethiopia along the Somalia-Ethiopia border in an area called Dolo Ado. There are 5 refugee camps in this area, and our work was primarily conducted within one of the camps called Boklo Mayo, where there are approximately 40,000 Somali refugees residing at the start of the project. Now, the program, as you know, addresses intimate partner violence, but I think one thing to keep in mind is that from the existing evidence, IPV is actually the most common form of gender-based violence in humanitarian contexts, but there is limited evidence on effective IPV programs for these sorts of contexts and for displaced populations. I think another thing that's really surprising to note is the limited funding that exists for GBV programs in humanitarian contexts. There was a recent study published last year by IRC and Voice, which reported that only 0.12% of humanitarian funding actually goes towards GBV programming. So there is a real need for this sort of work and for funding to support it. Next slide, please. And so the aim of this project was to adapt UBL for the Somali refugee context and to pilot it. Next slide, please. And so let's start by quickly discussing the original Unite for a Better Life program before delving into the details of the adaptation process and pilot testing. Next slide, please. Okay, so Unite for a Better Life is a gender transformative program that comprises 3 main components. It includes a gender transformative curricula. It includes sessions that are delivered within the context of a cultural or community practice. and it includes high quality facilitation. And so these sessions are delivered in a participatory way by trained facilitators. And in rural Ethiopia, they're delivered within the context of the traditional Ethiopian coffee ceremony. The aim of embedding the intervention in a cultural practice is to increase its cultural relevance and potential effectiveness of the program. Now, in rural Ethiopia, the program comprises 14 different sessions, and these are delivered twice a week over 7 weeks to groups of women, groups of men, or groups of couples. And there are typically about 20 participants per group, and usually you stay with your same group for the course of the program. The examples of session topics, some of them are provided there on the screen, but these include topics such as gender roles, healthy sexuality, HIV and condom use, boundaries and sexual consent, power and control in relationships, joint decision-making, task sharing, communication, emotional regulation, conflict resolution, as well as supporting survivors. Next slide, please. So the UBL program development process was guided by the Ecological Framework, which you see on the screen now. This framework seeks to describe the interplay of personal, situational, and sociocultural factors that combine together to contribute to risk of intimate partner violence. This is best visualized as 4 concentric circles, with the inner circle representing the biological and personal history that each individual brings to his or her behavior within a relationship. The second circle represents the immediate context in which abuse takes place, so within the family or intimate partnership. And then the third circle comprises institutions and social structures, both formal and informal, in which the relationships are embedded, such as neighborhoods or the workplace. And finally, the fourth circle represents the economic and social environment, and this, of course, comprises as well social norms. Next slide, please. So on this slide, you will see the theory of change and the logic model for the Unite for a Better Life program. And you'll see that it does align very nicely with the ecological model I just presented. And so given the complex set of factors that do interact together to contribute to intimate partner violence risk and also HIV risk, the program took a very thoughtful approach to addressing factors at all of those different levels. And on the bottom there, you can see the outputs, outcomes, and sort of potential impact of the program according to the theory. And you'll see that the program really aims to improve knowledge, attitudes, and skills related to IPV and HIV, as well as improve couples' healthy communication, increase task sharing and joint decision-making, reduce HIV risk and substance use, and ultimately reduce HIV transmission. Next slide, please. And so the facilitation model for the program is illustrated here. The role of the facilitator is to draw out knowledge and experiences from participants and foster discussion and dialogue to shape attitudes, to build skills, and to increase motivation to change behaviors among participants. This does contrast with traditional educational models where the teacher is seen as the main source of information, pouring knowledge into the minds of students. And so I will say that during training, facilitators first participate in the Unite for a Better Life program as participants or attendees. So they go through the program as if they were actually participating in order to reflect on and address any gender inequitable norms that they themselves may hold. And then following completion of the program, they then go on to receive specialized training and facilitation skills. There are 3 different versions of the curricula: women's UBL, men's UBL, and couples UBL. And the facilitation model is adapted to each type of group composition. So in men's groups, there will be male facilitators. In women's groups, women's facilitators. And in the couples groups, there will be one male and one female facilitator. Next slide, please. And as I'm sure many of you are aware, gender roles and norms start to become defined at a very early age. And in rural Ethiopia, while men and women do participate in the traditional coffee ceremony, typically it's women who prepare and pour the coffee. And so implementing the program within the context of the coffee ceremonies actually also offered an opportunity to model and promote more equitable gender norms and behaviors. So the program was designed so that in the men's groups, male participants actually have to take turns preparing coffee for the other participants. And so it's designed so that the first 2 sessions involve the male facilitators modeling the behavior around preparing and serving the coffee. And then for the subsequent sessions, the male participants take over and perform that task for the remainder of the sessions. Similarly, in the couples group, the 2 facilitators model the preparation of the coffee for the first 2 sessions, and then for subsequent sessions, each participating couple will take turns preparing the coffee. And I will say that it was sort of a controversial idea when our team came up with this back in 2012, 2013, to sort of try to push some of the boundaries of behavior and norms through the coffee ceremony. And I think there was some fear that men may reject participating in the program when they learned they would have to participate in this sort of behavior. But I will say that after having rolled this out across 64 villages, as you saw in the randomized trial across thousands of households, we never had a single man drop out of the program because of this. And actually it was really well integrated into the program, and I think made the program more effective. Next slide, please. And just to give you a little taste, here's one of our male Unite for a Better Life participants in Ethiopia who's roasting the coffee beans as part of the coffee ceremony. And normally in these rural areas of Ethiopia, this would be a very unusual sight to see a man performing this task. Next slide, please. And then here's just an image of couples participating together in one of the couple sessions of UBL. Following the presentation, we will share with you some additional resources about the program and the research, including a short video that's available on YouTube that highlights some of the elements of the program. So for those of you who are interested to see a little bit more of the program in action, I will advise you to take a look at that video online as well. Next slide, please. And then I also wanted to share with you a couple of quotes from Ethiopia, from the Unite for a Better Life participants and program facilitators. The first one is a quote from a program participant, a woman, who says, "Thanks to the discussions, our husbands are respecting us more than ever. We, the ladies, talk about this over coffee and think that our partners who participate in the program are on the same track." And then the second quote is from one of the UBL facilitators who describes how the program has transformed his own life. He says, "This program has made significant changes in my personal life. There were many traditional gender norms that I considered impossible to change. This program has enabled me to change this way of thinking." And as I mentioned, the results of the RCT are forthcoming, so please do be on the lookout for those. Next slide, please. So now we will speak more about the adaptation process, where we worked on taking this program that had been developed and tailored for one particular context in rural Ethiopia, and sort of working with our team and with the community in Dolo Ado to adapt it for a completely different setting. Next slide, please. And so this project was carried out between 2016 and 2018. And it involved first the conduction of formative research to inform the adaptation process, then development and adaptation of the sessions for the Somali refugee context. We pre-tested the sessions with 10 couples and refined the content, as well had the sessions externally reviewed. The final pilot versions of the program were then pilot tested within the camp. We recruited facilitators locally from within the camp, and they received training, as I described earlier, along the same model. And then the sessions were delivered to randomly selected groups of women, groups of men, or groups of couples. And we collected data before the program was implemented and follow-up data as well after. Next slide, please. And so the aim of the formative research was really to understand the gender, social, cultural, and religious norms that contribute to IPV in this setting, as well as the impact of displacement on these norms. And so I've included on this slide a model that was in a recently published paper by Andrew Gibbs and colleagues, which is basically an updated model for understanding the drivers of intimate partner violence. And what I really appreciate about this model is you can see along the bottom there, it does include armed conflict and post-conflict situations, and notes that, you know, those situations exacerbate the structural factors such as gender inequalities, normalization of violence, and poverty, as well as individual level factors such as poor mental health, childhood neglect, disability, that underlie IPV risk. And I think our findings from our formative research really align nicely with this model as well, because we do see that displacement influences and exacerbates some of those factors that are underlying IPV risk in the Dolo Auto setting as well. Next slide, please. So the research involved 30 in-depth interviews, 10 focus group discussions, and 10 participatory learning activities, which are more participatory means to collect data. So this involved vignettes around scenarios related to intimate partner violence or gender-based violence, and as well free listing exercises. We also conducted 3 community mapping exercises where participants drew their community and highlighted areas that were safe and unsafe, and areas that, you know, had greater risk, and so on. The research involved participants from a wide range of different categories. It included men and women of different age groups, as well as service providers in the camp, individuals working at NGOs and with the UN agencies, as well as some members from the host community as well. Next slide, please. And so the research found the following. So numerous forms of gender-based violence are being perpetrated against women and girls in this setting. And this includes physical, sexual, and verbal violence, which are occurring both in the camp, but also in the host community. Non-partner sexual violence, including rape at firewood collection sites and at food and water distribution points, was described by numerous respondents. But I will say that intimate partner violence was still the most common form of GBV described by participants. So despite all the risks that are occurring both in the camp and in the host community, the home is still the most unsafe place for women, even in this setting. And you'll see on the right-hand side, these are some data from our baseline study that was part of the pilot study, just to give you a sense of prevalence of IPV in this setting. Around 80% of women reported experiencing physical intimate partner violence in their lifetime, and 69% of women reported sexual IPV in their lifetime. So, those are extraordinarily high numbers, and it just, I think, stresses the urgency and need for interventions to address this issue. The research also, as I mentioned, focused on understanding how displacement has contributed to GBV and IPV risk. And we have seen from our work that some of these displacement-related changes are exacerbating GBV and IPV risk. For example, lack of employment opportunities and loss of Somali cultural practices were noted to impact mental health, leading to increased substance use. And in this case, substance use refers to Khat use, which I'll talk more about in a minute. And this was particularly among men, where substance use increased. And that in turn contributed to increased perpetration of intimate partner violence. There was also reported increased access to education for women and girls in the camp compared to their previous communities back in Somalia. So they had increased access to education. And this was seen as both a harmful and a protective factor with respect to GBV, just because of the way these factors are linked together. So in the camp, there are better economic opportunities for women and girls because they have this increased access to education. But this in turn also shifts traditional gender roles, where women take on more of the breadwinning role, bringing in financial contributions to the household, and this potentially increases tension within the household, and in households where there's been violence, exacerbates IPV risk. There have also been some changes in marital practices. We've seen reductions in early and forced marriages, reduced dowry, and reduced polygamy. A lot of this, especially the reduced dowry and polygamy, are driven by the financial situation and poor economic conditions in the camp. So dowry is not affordable, and multiple wives aren't affordable for most residents of the camp as well. And so these marital practices are important to keep in mind, not only because they're reported to be linked to increased IPV risk, but also because they have implications for program design when it comes to IPV. And so we'll talk about that a little bit later, but if you're thinking about couples programming for intimate partner violence, and a high percentage of the population includes polygamous relationships, we may need to think about the design of couple activities and things like that to make sure it is tailored, for the types of marital practices that exist in the setting. And then the research also highlighted this complex interaction between these numerous factors underlying GBV and IPV risk, the changes to social and cultural norms, to poverty, changes related to access to resources and physical spaces, but also persistent gender inequalities that exist in this setting. And all of this combines together to contribute to a risk of violence against women and girls. Next slide, please. To give you just a little bit of a sense of the prevalent norms and attitudes in this context, I've included some quotes related to the position of women and their role in society that emerged from the qualitative data that we collected. So I'll just sort of start on the top left, and we'll work our way across the top and then the bottom after. These are just a selection of quotes that I felt were particularly striking. And we can start with the first one there. So she should endure violence for the sake of Allah. The next one is, inside the family, there is greater violence. She looks after the children. She prepares a place for him to sleep, cooks the food, and fetches the water, but still he treats her brutally. The next one, her duties are, whenever he needs sexual intercourse, she must be ready if it's day or night. And then on the bottom, on the left, in his mind, the wife in the house is like an animal, and she belongs to him because he paid a wealth. So that one's around dowry. And then the middle one on the bottom, this quote was in relation to, this was actually a woman who gave this quote, and she was speaking about why men should be the primary decision makers in the household. And she mentioned that women don't have the capacity to make decisions because she is equivalent to half of a man. And then the very last one there, when a girl reaches puberty, she must be engaged. A Somali proverb says, girls must be married or buried. That's our tradition. Next slide, please. And I mentioned Khat Use a few slides ago, and so I wanted to touch on that really quickly. Khat is a plant with stimulant properties that's frequently chewed in the Horn of Africa. And in this context, in the camp, we were interested to learn a little bit more about Khat use and IPV, and it emerged from our research that displacement-related factors related to poverty, stress, trauma, those have contributed to actually increasing consumption of Khat use among men. And it was clearly described that Khat use contributes to IPV in this setting as well through 3 different mechanisms. So down below on the bottom there, you can see the 3 mechanisms outlined. 2 of them are direct and 1 is a more indirect route. But respondents talked about how Khat use leads to anger and aggression, particularly those who really consume a lot and become addicted to it. There's aggression and anger, in particular when there are withdrawal symptoms or after sort of long days of consuming a lot of Khat. And so that anger and aggression can eventually lead to physical intimate partner violence. As well, respondents talked about increased sexual desire with Khat use and how that can also lead to sexual IPV. There were some quite striking quotes about sort of men chewing Khat all day and kind of all night and returning home intoxicated in the middle of the night and, you know, having a desire for sexual intercourse and forcing his wife to perform. And then the third route is the more indirect route where Khat was described as having significant economic impacts on families, particularly men who are addicted will utilize the limited resources that the family has in order to support their Khat habit and to purchase Khat, and that leaves the family hungry and without resources. And so that can escalate and lead to violence because it exacerbates tensions in the family. And so I believe you've seen, or some of you in the invitation had seen, there was a link to a paper on displacement-related changes in marital practices. So that highlights some of the work we've done. There's another paper coming out very soon about Khat use and IPV in BMC Public Health. So keep on the lookout for that as well. Next slide, please. And then so basically all of that formative research fed into the adaptation process, which involved several steps. We convened a workshop with partners to develop and adapt the theory of change and logic model for the program. We adapted existing content for the Somali culture and refugee context. This involved ensuring that the role plays, stories, and activities were culturally appropriate and relevant. We also selected a platform for delivery, which was based on the formative research and sort of understanding cultural practices that are still being undertaken in the camp. And so it was decided to deliver the sessions during Somali tea talks, because this is a popular way for people to gather and discuss issues in the camp. And then additional content was also developed to address displacement-related factors contributing to IPV. And so that included 2 new sessions. We included one session on harm reduction related to Khat use, and we also included a second new session which focused on sexual harassment. The sessions were then translated to the local language, pre-tested with 10 couples in the camp, externally reviewed, and then based on feedback from the couples and from the external review, they were further refined and finalized. And then we'll get to that in a minute. They were pilot tested. And one of the things to keep in mind during the adaptation process is balancing adaptation with fidelity. And by fidelity, we mean the degree to which the adapted program maintains the essential components or ingredients of the original intervention. Next slide, please. And so this is the final set of the 16 adapted UBL sessions. I'm not going to go through all of those. I think you will have access to the presentation after. So for those of you who are interested, you can take a closer look later on. Next slide, please. And then I wanted to touch on some of the lessons that emerged from the adaptation process. So first of all, I think it's essential to prioritize community-based participation in development, adaptation, and implementation processes. And then, you know, the formative research, which I've spent a lot of time talking about, I think was really critical for us to really understand IPV in this context and how we can tailor content to address the key determinants that are operating in this setting. I will say, though, that we recognize that formal research may not always be possible in such situations. And so in those cases, I think it's important to gather as much information as is possible, perhaps through existing data, through conversations and dialogue with stakeholders, and through literature review. The program content should be adapted, taking into consideration both the contextual factors, but also displacement-related factors in a humanitarian context, but all the while keeping in mind ensuring fidelity to the original components of the intervention. I've listed out in this table some examples of contextual factors versus displacement-related factors, and we've already sort of touched on many of those. And then program delivery considerations also need to be taken into account. So that includes things like timing, frequency of sessions, the location of sessions, and ethical considerations. Next slide, please. Next slide, please.
Sawa.
Oh, sorry, one back. Exactly, there we go. Sorry about that. My connection, I think I lost connection for a second, but I'm back. And then there are a couple of lessons around humanitarian context in particular and program adaptation. And these are available in a policy brief that our team put together called UBL Lessons on Adaptation. That's available online, so we will provide the link for that later if you'd like to read more about this. But some of the things to think about around programming in humanitarian contexts is the type and phase of emergency, as this may affect feasibility of implementation, participation rates, and stakeholder engagement. As well, existing programs, resources, and services, especially those for GBV survivors. It's really important when you're implementing programming like this that you have a clear pathway for referrals for those individuals who may be experiencing violence at home. As well, I think it's important to think about indicators for gender and gender equality in different settings and how those might be influenced by displacement. That's really important to think about when you're setting up your monitoring and evaluation processes. The fourth one listed there is disruption of social cohesion, including disruption of family structure, changes in relationship dynamics that result from displacement. And I think this is important to keep in mind, as I touched on earlier, you know, when you're thinking about things like couples programming, thinking about sort of the actual real composition and structure of families within context is important to consider. And then displacement, as you've heard, may lead to economic consequences, financial stress, coping strategies such as substance use. These may influence relationship dynamics and IPV risks. So it's important to think about how some of those issues might as well be addressed. And then finally, some of the community and cultural practices that that are important to a culture, they may change as well because of displacement. So if you're working on an intervention such as this one, which is being implemented through community practice, I think it's important to understand how those community practices are being used and implemented within the context. Next slide, please. And so we'll really quickly just touch on the pilot testing, just to give you a sense of what our research involved and the findings. So we'll move to the next slide now, please. So essentially, I think the pilot results were very promising. We had fairly high participation rates, in particular among women and couples. The participation was a bit lower in the men's arm, but I think we learned a lot around sort of how to engage men more in this intervention. And a lot of it had to do with sort of timings that the program was being offered and location and things like that. The key indicators that we collected did demonstrate acceptability, relevance, and utility of the program. We tracked unintended consequences and potential risks to participants as well, and are happy to say that none of the participants reported spousal conflict or violence as a result of participation in the program. 95% of the women who participated indicated that they'd shared information that they learned during UBL sessions with other people, and that included spouses, friends, neighbors, and relatives. And the average number of people that each woman shared with was about 7. And then, over 90% were satisfied or very satisfied with the program as well. Next slide, please. And then I just wanted to quickly touch on some of the changes in attitudes and norms. And so some of them, around 5 or 6, are depicted on the slide here, just to give you a sense. So you'll see that the white bar is the baseline level, and the red is the end line. And again, this is all women's data. And so let's just look at a couple of them, and then feel free to look at the rest on your own. But the second one down, the second indicator, it is acceptable for a man to beat his wife if she is unfaithful. So at baseline, about 70% of women agreed with that statement. By end line, after participation in the program, this had dropped down to just over 40%. Another interesting one, the fourth one down, it disgusts me when I see a man acting like a woman. And around 81% of women agreed with that statement at baseline, compared to about 30% at end line. And so I think these findings do demonstrate that this program is quite promising and potentially able to influence gender attitudes and norms. However, I do want to note that this was a pilot study, and therefore, sample sizes were small and the follow-up period short. So our team is really interested in conducting a more rigorous, longer-term evaluation where we can actually look at some of the longer-term outcomes over a greater sample size. Next slide, please. And then I really quickly wanted to share with you one of the case studies from this project. And this as well, we have a case study document that I will share with you the link. It's available online as well. But we just were delighted to have the opportunity to visit some of the participants a year after their participation in the program. And were touched by some of the changes that were described. So there was one man that we spoke with named Abdullahi, who is, he was 33 at the end of last year when we spoke to him, and he had participated in the couples program together with his wife. And he described how when he was looking back at the program and kind of being grateful for having the chance and opportunity to participate in it, he told us about the life-changing impacts the program has had on his family. He described how both him and his wife gained practical skills that enabled them to live a more equitable and healthy life together. He described how he used to harbor traditional views of the role of a man as the provider of the household and believed that women should only take part in domestic tasks, including childcare, and no other tasks. And he told us that before participating in the program, he would not allow his wife to work or to participate in any major decisions. But through the program, they began to question some of these traditional norms, and they also worked to improve their communication skills. And so his wife described to him her dream of opening up a restaurant in the camp, and Abdullahi decided to support her. So within 3 months, she had opened up a restaurant where she serves food and tea to the community members in the camp. When we went to visit a year later, it had been open for about 7 months, and it was quite full and looked to be very successful. And Abdullahi told us that, you know, while his wife works, now he takes care of household duties. So he fetches the water, cuts firewood, takes care of the children. He even takes their 1-year-olds to the restaurant several times a day so his wife can breastfeed the baby without disrupting her work at the restaurant. He says that some people may talk about their relationship in a negative way and mock him for doing women's work, or what's considered to be women's work, but that he doesn't care. He's very proud that his wife is generating this income for his family. So next slide, please. And then this slide just highlights some of the good practices and challenges. I've actually already talked through most of these. So I in the interest of time and wanting to make sure we have time for questions, I am going to move on to the next slide and just kind of summarize what we're hoping to do for the future. It is important that we address IPV in humanitarian settings and that we prioritize it. To do this, we need evidence-based programming because it's the most effective way to achieve sustainable and meaningful change for communities. And we need to prioritize funding as well for programs in these settings, as well as research to what works, to understand what works. And our vision really for the intervention going forward is to be able to conduct a rigorous evaluation to assess longer-term impacts. We're also interested in comparing this program with other modalities of program delivery. For example, the third project I mentioned at the very start when I was sort of sharing the different projects that fall under the UBL umbrella was the podcast project. And that project was also developed in the same setting, and it involved sort of converting the sessions into 20 to 30 minute audio podcasts, which are comprised of dramas and expert interviews. Now, those could be complementary to the in-person sessions, but they could also be used in place of, especially when it's mobile populations that are on the move and can't gather twice a week for 8 weeks. So we're really interested actually to test out or compare sort of an in-person modality versus the podcast approach in a more formal evaluation. And then as well, we definitely are interested in scaling up in Dolo Auto and also thinking about other sites where the program may be effective and starting to engage in some work to begin implementing in other settings. Next slide, please. And really quickly, this slide just highlights some of the resources that are available for potential program implementers or facilitators. We have 3 versions of the curricula, one for men, women, and one for couples. They're available in English, Amharic, and Somali languages. We also have a Unite for a Better Life program implementation and facilitator training toolkit, as well as a visual media toolkit. The visual media toolkit was designed to build empathy and challenge gender norms through visual media approaches and is intended for program implementers and master trainers working in GBV prevention and or in humanitarian settings. So feel free to contact me for more information about these resources. Next slide, please. And so I'm going to end here, and I just want to thank you all for being here and for being for participating in the webinar. And I look very much forward to the questions, and also thanks to the London School for hosting the webinar.
Wonderful. Thank you so much, Vandana. That was really fascinating. And yeah, I can tell by the number of people who are commenting on how wonderful they thought the presentation was, and we've got loads of questions already. So I'll just go right ahead so that we can get as many in as possible if you're ready. So I'll start with some of the questions on social norms and social norms change. And we've got a few people who are asking about the indications of change you got over the course of the pilot study. And I think you actually kind of ended up answering that question as you went through the presentation. But there was one question in here from Jennifer who was asking about positive norms and attitudes, and whether you identified positive norms and attitudes at the beginning and whether you worked them into your programming and pilot study.
Sorry about that. I was on mute and I forgot to unmute myself.
No problem.
Great. No, that's a fantastic question. We definitely were interested in understanding like protective factors and positive norms as well. So, there's some more around that in some of our papers. So, I think one of the areas where there were certainly positive norms were around the value of education. There were positive norms around sort of increasing age of marriage, and those norms were reported to have changed since displacement. So, being in the camp setting, having access and exposure to a variety of different people from different parts of Somalia who wouldn't normally be mixing together, coupled with the programming that's being implemented in the camp, as well as the legal and policy context of Ethiopia and the laws against sort of early marriage and things like that, I think have contributed to some of those sorts of shifts. But no, I think it's a great question. And we certainly did look into some of that, and we're very interested to leverage some of those attitudes as well.
Great, thank you. We've now got a question from Michelle, and she's asking about displacement and how easy or hard it is to attribute change to displacement. She said that some changes might have already been in process before the people were displaced, and it can be hard to distinguish between these. And she's given the examples of financial stress, IPV, and substance use, perhaps being part of life in these communities before. So did you look at this complexity in your study, and how did you, what she said, yeah, how did you kind of consider this and manage this as part of your study?
Yeah, that's a great question. And I completely agree with the comment. I think it is very difficult to tease out the effects specifically of displacement. I mean, the way we worked with this issue in our study was to ask people their perceptions of sort of prior to displacement versus post-displacement. And so again, these are perceptions. We don't have data from the same population prior to displacement to really compare with. So, I will highlight again, these are perceptions of the community members and what's changed.
Mm-hmm. Thank you. We've got a question from Elizabeth, or Liz, and she said, yeah, great presentation, Vandana. And she'd like to know more about how long you spent on the adaptation stage. And if we were to develop shared messages around adaptation, yeah, so can you just speak a little bit more about the adaptation phase and how long it takes, and the fact that it's such a critical step that needs investment in time and resources?
Absolutely. So I believe the formative research probably was around the first year of the project or so. And I would say the adaptation probably took around a year as well, just because we did have those multiple steps, like including sort of the different workshops, the, different levels of input from the community. I don't know if I mentioned, but we had a community advisory board that we set up as well that had diverse members from the community, and as well as religious leaders, clan leaders. And so various groups were represented in that. And so they were involved as well. And then we also had an external review process and I think one of the most lengthy parts of the whole thing was sort of translation and, refinement, and then, kind of retranslating changes and things like that. And then having all of that validated again to make sure it was all correct. So I would say probably about a year for that adaptation process.
Mm-hmm. Wow. So yes, it really is a long time. And there's a related question here about the balance or tension between fidelity and adaptability. And this person, AK, has asked what this really looks like in practice and who is involved in making the decisions. And I think you've kind of expanded on that there, but maybe you can say a little bit more about that.
Yeah, I think that's a great question, and something, we had internal discussions about, I think, over the course of the project. I think we struggled to find a lot of guidance out there already that sort of could help us make some of those critical decisions about how to balance that tension. And I think that's one of the reasons we put together the briefing note that we did around adaptation, because I think there is a need for more sort of direction and guidance around that. I think working with our colleagues who developed the original Unite for a Better Life, some of who I think are actually participating in the webinar right now, I think we tried to work out what the key elements of the program are that lead to its potential impact. And I think if you remember one of the slides I presented, it was, the high quality or gender transformative curriculum, the high quality facilitation, and the delivery through a community practice or platform. So I think those key elements were essential to keep at all elements, and then at all stages of the adaptation. And then I think building in additional content was important, just because there were drivers of IPV that were apparent in this setting that weren't in the other setting, and that weren't being addressed. And so that's why we added the session on chat use and on harassment and stress.